Hello, this is Respiratory System video number 2. In this video, I would like to discuss the respiratory zone of the respiratory tract. And a slight correction from the last video, I mentioned that the respiratory zone, I mentioned that the conducting zone continues down into the respiratory bronchiole, alveolar duct, and alveoli. That is the respiratory zone, those structures. Okay, so a little bit about the bronchioles too. I want to add on to that some information from the previous video. We ended with bronchioles, and I mentioned those are small tubes less than 1 millimeter in diameter. Another thing I want to mention about those is as you progress through the bronchial tree, the amount of cartilage present decreases in the wall of the tubes. So a lot of cartilage is needed to support the open airway in the larger tubes, but in the smaller tubes, that's not necessary anymore. The wall without cartilage is strong enough to support that open airway. And in the bronchioles, you see there's no cartilage anymore in the wall. Also, if you do a cross-section through the wall of the bronchioles, you'll see basically what's in this slide. There is a layer of smooth muscle surrounding the bronchiole in the wall. Muscularis is the name of that layer, and that surrounds the submucosal layer and the mucosal layer. Being smooth muscle, this layer can contract, controlled by the autonomic nervous system, and contraction causes constriction of the breathing tube, the bronchioles, called bronchoconstriction. Relaxation dilates the tube, bronchodilation. Now, the bronchi and the bronchioles can get inflamed, and they can get inflamed by infection or by irritants, smoking, or pollution, for example. And that's called bronchitis or bronchiolitis, inflammation of the breathing tubes. All right, so I want to progress into the respiratory zone, and this slide shows some of the structures. So progressing through the bronchial tree, we're reaching the dead end here. And the dead end is where the gas exchange is going to happen. So there's some features I want to point out. So leading into these structures is a respiratory bronchiole. Basically, that's the smallest part of the conducting zone. And that's going to lead into an alveolar duct and into alveoli. Now, the structure illustrated here is called an alveolar sac. An alveolar sac is not the same thing as an alveolus. An alveolar sac is basically a cluster of alveoli. So these are all these globe-shaped structures here. These spheres are the alveoli. They're clustered together into an alveolar sac. One thing also I want to point out is that an alveolar duct does not connect directly to all the alveoli. So it's going to deliver air into the alveoli that are nearest to it. But there are passageways between connecting alveoli, the alveolar pores, that allows air to pass to these alveoli distant from the alveolar duct. Another feature shown on this slide is the abundance of elastic fibers that are surrounding the alveoli. Lung tissue is very elastic, as you probably know. You're able to expand and contract the alveoli, and that's involved in the process of breathing. And finally, another thing of interest on this slide is surrounding the wall of the alveoli, and it's shown for these alveoli on the left, but it's true for all alveoli, is an extensive capillary network. These are the pulmonary capillary beds. And that's where the actual gas exchange is going to occur between the air in the alveoli and the blood in these capillaries. All right, this slide is showing some of the same structures now, but in only a segment of an alveolar sac. And it's an electron micrograph, scanning electron micrograph. And we can see terminal bronchiole, respiratory bronchiole, and alveolar duct. So you can see the alveolar duct has many alveoli coming off of it. These tubes, not especially terminal bronchiole, none. Respiratory bronchiole, maybe a scattering of them. All the spaces here are the internal chambers of the alveoli. They're air-filled structures. The total number of alveoli, 300 to 400 million alveoli per lung. Huge number of alveoli present. Let's see. Next slide is showing, it's kind of a cartoon version of an alveolar sac. And you can see the alveolar duct leading in and the alveolar pores that are connecting neighboring alveoli. And this is a section, a light microscope, a section through the alveoli of an alveolar sac. And you can see the light blue here is mostly open space. There's, the tissue present in the lung is very scattered because of all the open space through which air is going to enter when you inhale. This slide is illustrating 3 different alveolar sacs. Here it's showing capillaries surrounding all the alveoli, the elastic fibers that you'll find there as well. So those are some of the structures that we talked about already. All right, now we're going to even further magnify the structure, and we're going to talk about if you section through an alveolar sac, what will you see, and what's making up the structure of an alveolus? So you can think of an alveolus as basically a sphere, and it's made up of, you gather a bunch of spheres together into a bunch, and some of these spheres share a common wall, and what's in the wall is the outer layer of the alveolus. So if you look at the cells that are involved in the wall of an alveolus, there are 3 main types: alveolar type 1 cell, alveolar type 2 cell, and alveolar macrophages. The alveolar type 1 cells are simple squamous epithelium, really thin cells making up the wall. So those are the most abundant, and on this slide they're kind of color-coded tan. And in cross-section here. And you can see these 2 alveoli are sharing a wall, so one of the type 1 cells here is bordering on both. Okay. The alveolar type 2 cells are less common and scattered in the wall amongst the type 1 cells. They're not so flat, more kind of cuboidal shape. The main function of the type 2 cells is that they are secreting a substance called surfactant. Because the inside of the alveolus is a wet membrane, there is a surface tension that tends to want to collapse the alveoli when you exhale. The surfactant basically coats the inside and reduces that surface tension and prevents collapsing of the alveoli after every breath. The alveolar macrophages are immune cells that are patrolling the inside of the alveoli, protecting against potential inhaled microbes or particulate thing, dust, things like that. The right side of this slide shows what's called the respiratory membrane. The respiratory membrane is the barrier between which gas diffusion occurs. And so what's on either side of this barrier is air inside the alveolus on one side and blood circulating through the pulmonary capillaries on the other side. The barrier is composed of the wall of the alveolus, the squamous epithelium of the type 1 cells here, the wall of the capillary, squamous epithelial cells of the endothelium here, and a fused basement membrane that's secreted by both of these cells. That's an extremely thin barrier, and so that's the best the body can do in terms of making a highly efficient, really thin structure for diffusion of gases during gas exchange in the lungs. So across this respiratory membrane, there are pressure gradients that are going to drive diffusion of oxygen out of the air in the alveoli into the bloodstream, and diffusion of CO2 out of the bloodstream into the air in the alveolus. I'm going to stop there, but I wanted to mention one more thing related to the alveoli and the surfactant that I mentioned before. The importance of this surfactant in reducing the surface tension is illustrated in situations where people don't have this surfactant. So an example of that is in prematurely born infants. The last part of what matures during gestation, in the last month or so, is the type 2 cells and production of surfactant. Fetuses in utero don't need surfactant, right? So if they're born before those cells mature, they don't have surfactant coating in their lungs. And so they suffer from what's called infant respiratory distress syndrome, IRDS. This is discussed in slide number 68 in your PowerPoint. And that the respiratory distress comes from the fact that every time they exhale, their alveoli collapse upon themselves due to the lack of this surfactant. So this can be treated by administering surfactant from the outside, and that's going to tide them over until their type 2 cells begin to mature and make their own surfactant. So I'll end this video here. The next video we'll talk about the gross anatomy of the lungs, and then that will lead into a few videos talking about the physiology of the respiratory system.